Hello, everyone. Thank you for coming on time. We are starting a new session today and a new topic. And if you go to, of course, we are in BSP WHS 401, and this is the unit. And we covered a few topics in the previous session or sessions. So we covered the introduction, then legal requirements for the work health and safety, policies, procedures, and programs. We also covered different risks and hazards. Then we were discussing consultation procedures. And if you remember, these consultations um, requires two-way communications. So the organization will create some policies related to protecting everyone in the organization, related to work health and safety in general under the Act, and also in particular field for this organization. So if this organization works in constructions, they have different WHS requirements other than another organization works in training, for example. So totally different requirements, but we still, in all organizations, we must have what's so called WHS, which is following the Federal Act, State Act, or laws, federal laws and regulations, state laws and regulations, also company rules and regulations. So we were discussing that the consultation procedures, it's a two-way communication. The organization will create that. It will inform everyone about that, keep informing them when they update their policies, procedures. So it's a continuous process. Also, we as stakeholders, people affected by this type of policies in place, procedures in place, wearing masks, social distance, wash your hand for 20 seconds, all these new policies since last year or the year before. So these updates came to the daily life. So because of that, we can also, because it affects us, we can give some feedback. We can give some ideas, suggestions. I'll tell you about something, and this has happened in TAFE when they introduced these policies about social distance related to COVID-19, almost more than a year now, almost 2 years. I noticed that we don't have any signs in the left saying that we need to have social distance also inside the lifts, inside the elevators. We need to have that there. We need to minimize the number of people using the elevator every time to only 2 because of social distance of 1.5 meters. So one of the elevators, it was small, and the maximum capacity before that it was like, I think 8 people, but because of social distance it's 2. So I told TAFE about that and they applied that. So this example, or this is one of the examples for us. We can improve the policies, procedures, daily tasks. We can improve on that. We can give our opinion. We can give feedback, and it's really useful. During this consultation process we discussed last time in session 4, we discussed different procedures and processes also. Then we discussed the different issues raised. We can have some issues and we try to work on these issues. Of course, everything will be filed, documented, And the problem-solving techniques will involve consultation, discussions. Maybe we are getting third party for improving the emergency procedures or fire alarms and so forth. Then from that, we are going to have an outcome. So today's topic, it's the one we are starting with, is communicate outcomes of consultation. So we had different discussions, and we have different meeting. So when you participate and discuss WHS matters, we need to, after reaching some conclusions, we need to communicate with stakeholders. Stakeholders is a term we use for people affected by doing or not doing, affected negatively or positively from this activity. So we need these informations to be communicated to everyone. In some cases, we use posters, emails, workshops, meetings, printed matters or printed documents on the different boards, in the toilets, near the water fountain, and so forth. So we will provide meeting minutes for the WHS committee, minutes from group meetings, different flyers, emails, as I mentioned, staff newsletters, bulletin boards, and so forth. So we use every way possible, sometimes text messages when we had some stronger restrictions for working from home, and because of COVID, I used to get a text message every day in the morning. It's like checking on me, checking up if I need anything. So we communicate this outcome, telling everyone, don't forget to wear masks. You don't need to come to workplace. If you feel some stress, call this number. So we have different means of communication. We use web portals, we use social media. Of course, for TAFE, we have different social media accounts on Facebook and LinkedIn. It's a good idea to visit these pages and keep yourself updated with what is there. We, as TAFE staff, we also have our internal network, intranet, where we check for different news, different processes, procedures, and we have something called single point of truth, a spot, and there I can find trustworthy news updates and updates for the policies and procedures, forms, and so forth. So it's a good idea to provide that. You will find also, for example, Centrelink and Medicare, they provide updates in different languages. So when you go to the Centrelink website, you will find that they are publishing their new policies, procedures, any updates, any news in different languages, actually, which is great. So if there are some people with minimal understanding of English, they can read and access this information in other languages, which will help them a lot. So this is the topic related to communicate outcomes of consultation. The next page, it's self-quiz. What are two systems or methods that can be used to communicate information about the outcomes of WHS issues? If any of you can come up with a new idea or some input here, something outside of the box, how can we convey the message? Please share, on chat, or you can unmute and tell me if you have some ideas other than what we discussed. Yeah, Discord, yeah, good. Text, group chat, okay. Emails, yeah, okay. Skyletter banners, yeah, good. Fax, drones, good.
Meetings.
Okay, whistleblowing, okay, good. Nest, flags, interesting. Teams, yes. Morse code. We can have some t-shirts, so right, with some prints like the ones we used to use to watch or see in shopping centers about sales, about discussion. Word of mouth also. Tell your therapist. So word of mouth also, it's important. Sometimes we are getting lots of emails, so maybe I don't read the emails, or I'm not at the workplace, so I didn't read the posters on the walls there. So during some meetings, I'll find my colleague, he's telling me, Sam, do you know that we have updated policy regarding 1, 2, 3, 4, or we changed that or this? So it's notes, yeah, in your pay slips. Yeah, yeah, okay. Trucks, vision carriers. Okay, can you search for vision protocol? Search for this one and read this interesting articles or topic about vision protocol. So you look interested in pigeon, but we in Egypt we eat pigeons. By the way, they are so delicious. Okay, smoke signals, yeah. Yes, IP over avian carriers, yes. Vision, yeah, yeah. Don't say we still use visions for mail. It's just a hobby. We use that in Egypt, in some areas, countryside. Good. So any other ideas? Also the background of the computer, I mean the wallpaper, we can enforce that through policy, and on my TIFF machine I have that. So this is one of the methods they are using. So about new policies, new procedures, emergency numbers, I have that on my wallpaper, and it's updated from time to time based on the policies they are updating or the information they wanted to convey. Even if I'm working from home or remotely, it will be applied remotely to my wallpaper, Windows wallpaper. Okay, that's good. Phone calls. My manager will call me and tell me we changed the policy. You need to come to campus tomorrow, or you don't come to campus tomorrow. We changed the policy. Something like that could happen also. So different methods. Thank you everyone for sharing serious comments, feedback, answers, or even the non-serious comics and jokes. It's good also to bring some fun here, especially with dry topics. So thank you. I'll any questions before I stop recording? I'll just stop recording for this one. We're done with this topic. So thank you. I'm stopping recording now. Thank you. We are going to the next topic.